My name's Peggy Mayfield. I'm the state representative for District 60, and I am seeking re-election. To my time in the legislature, I really didn't have much direct interaction with members of the disabilities community. So this has been a tremendous learning experience for me, not just in seeing people with disabilities in a different light, as I should say, seeing their capabilities in a different way. It has helped me understand some of the complexities of how we deal with them in policy making and how we can improve upon that going forward. And believe me, Stone Belt has been a tremendous help in helping me understand all of the details behind the scenes. So I think that working together, organizations like Stone Belt, the legislature, and the Medicaid office coming together to try and pressure those reimbursement rates and that pay rate for the DSPs is a difficult but probably better program to pursue. And I would support legislation that would help pressure that, whether it's requesting a report from them saying, here are all of our rates, and then we can work on those, or different methods that will bring those DSPs more in line with other healthcare professionals, and certainly the kind of training that's needed to assist our disabilities community. Functional rehab is such an integral part of making a member of the disabled community feel true self-worth when they're providing for themselves. So yes, I support that concept. I was not aware initially that the order of selection really made the priority on the hardest cases, and that the easily employed or easier to be employed were sort of being overlooked. And I think that we maybe need to look at that so that we can get more people in the workforce rather than just the most disabled into the workforce. People with disabilities, as I mentioned early in this interview, they have abilities that are not always apparent to the able-bodied community. So, and I think that's becoming more and more focused on, especially on the spectrum. You look for the strengths. Let's use their strengths instead of trying to make them fit into a mold. So that's the kind of legislation I would be happy to support. Fully funding, I wish we could fully fund every program out there. The truth is that we probably just can't. But moving forward and getting monies where we can find them to be the most useful is a first step. And then expanding on those programs so that we can branch out and maybe not experiment, but try those new ideas to see if they work. Get those pilot programs out there. That would be something else that I would like to support as well. And once we get the kinks out of programs, then we can launch them statewide. Regarding our 2021 budget, we are a little cautious because we don't know what those revenues will be. What we spent through the 2020 interim was really money that was earned in 2019. And since there was no COVID, incomes were not affected. So our budget hadn't been affected yet. The collections of it were delayed, but the money was still owed. 2021 is going to present an interesting challenge because we don't know exactly how incomes were affected. We have to be very deliberate when we're making our budget. However, having gone through that budget cycle when we restored the pay rates for DSPs and knowing the struggle, because it was more than one session that we dealt with that, I definitely support doing everything possible to maintain at least what the disabilities community is already getting. To be honest, I think it would be very difficult to justify reducing it, because you're already literally at the lowest rates necessary to function. And as we look forward in the future of augmenting that, I think we really need to protect the base right now.